Deborah was told the surgery is the only option. Not necessarily. Listen to her story. I think you'd be impressed.
Hi, I'm Debra Benson, and I came here 2 years ago from a recommendation from my brother. My brother had actually been trying to get me here for quite some time, and I was resistant because I was going to medical doctors. And so when I did come, I worked with Dr. Winter for a while. I had had a cervical fusion, 4, 5, and 6, and I'd also had a lumbar fusion from T11 down to S1, which is 7 levels of my spine. I was in pain management with medication, taking hydrocodone, taking muscle relaxer, Flexeril, and still in pain, lots of pain. So after surgery, I came here and worked with Dr. Winter. I had been told I was going to have another cervical fusion, and I wanted to avoid that. So that's really what brought me in. And so I worked with him for a while. Now it's 2 years later. I'm back for tune-up, I like to call it. And after 2 years, I haven't had a minute's problem with my neck. I did not have the second fusion, cervical fusion. And it's amazing. I don't have any pain. I don't take any medication for pain. I don't take the muscle relaxers at all anymore. When I have pain, it's not in my neck anymore. I do still have pain in my back, but I take a couple of Tylenol. And so I'm back for a tune-up, and I have a couple of other issues. My hips, I've been told I need double hip replacement. I've been told I need knee replacements. So that's why I'm back, because I don't want to do those things. I'm not exercising successfully. It hurts. So looking forward to seeing what kind of results we get. And after a couple of treatments this week, already I feel better. And so I think you should come and check it out.
Good. You're exactly right. And you should. You're exactly right, people. Get in here. Good. Geez, I actually said everything I need to say here.
Except I didn't say, you mentioned the doctors tell you that you've got to do this.
Oh,
and you're
very
not
good.
going to have any more problems. I didn't know how to
yeah.
segue into that.
Okay, well, I'll just segue back with it. So you might say, so Dr. Winter and I talked about this, and what he mentioned is that a lot of people, after they have the surgeries, they're told the surgery's going to be, once you're done with the surgery,
yeah.
all the pain's gone, there's now going to be another problem. And obviously you didn't find that to be the case. So when you had your surgery, can you tell what happened after your surgeries?
Yeah, I was told when they were doing the x-rays before my cervical fusion, the doctor also noticed that I had scoliosis, degenerative scoliosis that was starting to rotate. And so after the cervical fusion, he told me I would need to come back for a lumbar fusion. I'd had scoliosis all my life. It had never been a problem. I was aware of it, but other than noticing one hip higher than the other one, I never had really experienced a lot of pain with it. So I was pretty shocked with that news. But I did go back and had the fusion. It was more fear that led me there. The doctor told me, this was a spine specialist, told me that given my age, I was 59 at the time, that I needed to go ahead and have the surgery, even though I wasn't having a lot of problems. I was having pain from my neck, but after I had the cervical fusion, got that sort of taken care of. Then I did notice I was having back pain. I just hadn't noticed because the pain was so great in my neck. But they told me that I needed to do it if I waited until my 60s or my 70s. By that time, the spine would have rotated more. The ribs would have been puncturing the lungs. I would have breathing problems. I might experience other traumatic health issues, but I would be too old to have the surgery at that time, and that's why I needed to go ahead and do it before it got bad or worse. I was rotated 28 degrees at the time, and was told that that was deformity, and it was deformity surgery that I needed to have. So I was told that it would be about a 6-month recovery, and that after that I wouldn't be having as much pain. Well, they lied. I was in a body brace after the lumbar fusion. I was in a body brace for 3 months, and I didn't have to sleep in it, but I had to be in it all during the day. I was on a walker. I was in rehab for 1.5 years. Started with aqua therapy, where they lowered me into a pool, and I moved around a little bit, but it was excruciatingly painful. Still on a lot of pain medication and the muscle relaxers, which I had already been on. But it was more like 1.5 years of rehab. I lost my job because I couldn't sit. I worked in an office setting. I couldn't sit. I had 3 months off from work, which was okay, but when I went back, I couldn't work. So I ended up going on disability, and it was not pleasant. I'd say it was really 2 years before I got over that large surgery. And after that, I still had pain. I still had a lot of pain. I was still on a lot of drugs. Prayerfully and thankfully, I didn't get addicted to the narcotic pain medication, as so many people do these days. So that's another danger. As I mentioned earlier, I'm not on any pain medication now at all. I take Tylenol, and so that's such a huge blessing.
How often do you take Tylenol?
Just as needed. I don't even take it every day. If I'm standing up in the kitchen or chopping things up in the kitchen, cooking, or for longer periods of time, I'll get some back pain at the mid-back, and I'll take the Tylenol then. But I don't even have to follow up 4 hours later. I think Tylenol's, you can take it every 4 hours, but I don't take it very often at all. I take it at night sometimes because my hips are bothering me now, which is why I'm back with Dr. Winter. And it sometimes wakes me up. But yeah, it's amazing. I don't have to take the drugs anymore.
Good. All right, for this little segment talking about the back pain, you did a great job, by the way. What would you tell somebody, say, gosh, if you have a choice about what kind of therapy you use to take care of a scoliosis or a back pain, what would your suggestion be?
What kind of therapy?
Well, again, somebody out there is trying to make a decision. I got this back pain and scoliosis. I'm trying to decide, what do I do here? Where do I go? Do I see this guy? So what would you tell them?
Well, most people don't do what Dr. Winter does. First of all, they have to know that Dr. Winter's treatment is different from your typical chiropractor. I didn't understand what kinesiology meant, and the other methods that he uses with acupressure, not acupuncture, but acupressure, and the cold laser, and working with the pressure points. That's not done by every chiropractor. So this place is really, I think, unique. As far as I know, I don't know of any other practice that does this. So I would say try this. Do not undergo the knife until you give this a shot, because I'm here to tell you I've done it both ways, and I will not be having hip surgery or knee surgery. I'll just be coming back here to Dr. Winter because he can fix it.
If you, like Debra, want to be healthy, call Dr. Winter at 770-536-6600.